Hi, I'm Richelle Garrow. I'm doing the simple suture requirement. I'm going to use the SutureVideo and a 3/0 black nylon suture. I do want to share with you the practice suture buddy that I'm using, made by Dr. Jamal Rahimi. It's got the dermis, epidermis, and the muscle tissue, so you can kind of gauge how deep you should actually go. It's been very great. And we've been practicing several different types of stitches. The flap's my favorite. So we're gonna do the suture, simple suture interrupted. I'm gonna use a needle driver and scissors and my tweezers or tongs with the teeth. I'm gonna wash my hands, don gloves. If this were an actual patient, and I would have already had the wound cleaned. And to load the needle driver, you go about 1/4 of the way from the thread to avoid the fragile part of the needle where it'll just kind of fall apart. And just to get my thread out of the way. And then I'm going to use my tongs to grab the tissue and just insert my needle. And you can do it one of two ways. You can pull through, leaving about 2 to 3 centimeters of a tail. And then you go into the other side for a simple suture. And the first, we're going to do 4 throws to secure the suture. The first is going to be a surgeon's knot, twice around the needle driver, and then you pull in opposite directions to secure. Once for a simple for the next 3 throws, pulling in the opposite direction each time. One more. Lost count. Okay, and then you clip and go on to the next. Now I'm going to do the split technique. And I like to leave the suture knot off to the side of the wound. Difficult to see black on black. Okay, same thing. And the idea is not too tight to cut off the circulation, and you can do it, I pulled it through each time, but if the wound is a nice clean wound like this particular incision, you can just thread right through to the other side and pull all the way through. And be careful that you're going in the right direction, pulling your thread, because if you go the wrong side of the driver, it's not going to tie. 1, 2, 3. And now I'm going to go into the middle and start approximating my wound. Surgeon's knot. Simple. 1, 2. Now I'm going to split these in half. Surgeon's knot. Simple. 2. Nope, see that's the wrong way. This is the right way. 4. And one more. Because that's all I've got thread for. And we're going to cut this one in half. Roughly. Surgeon's knot. Simple. 2 and 3. And that's 5 simple interrupted sutures. And you would just keep going until the wound is well approximated all the way end to end. Thank you.